It's so close to home now. Reality is really set in. Hey, this can happen to anybody, anytime, anywhere.
When we first called Terry Greencorn today, he couldn't talk. He was desperately worried about his wife.
I did have to call 911 this morning just to make sure that her oxygen levels were good enough that she didn't have to go to the hospital. And they just told us to keep an eye on her for now.
Later, he told us his entire family has COVID-19. Greencorn tested positive too, but doesn't have any symptoms.
Good thing is, somebody's able to help the rest of the family out. So thank God for that.
They are now among more than 1,200 Nova Scotians battling the virus. There are 40 people in hospital, including 9 in the ICU. The doctor in charge of coordinating critical care says he can find more beds, but that's not the only issue.
Our biggest challenge will always be around finding the human resource team that looks after the patient for that bed.
In the space of 2 weeks, new cases have surged from an average of 10 a day to more than 120.
This is probably the most difficult time I've been feeling, or the hardest for me over the whole pandemic.
The numbers may still seem small, but not here, not for a province this size. And that's why Nova Scotia's top doctor says he has implemented restrictions quickly, especially with variants in play.
We buckle down and do what we need to do, and we'll get through this, and we'll do it within the capacity of the healthcare system. If we don't, then it's a much scarier picture.
Can we get back to COVID zero? Can we eliminate this?
For Nova Scotia, that means having, very single digit or less. We can get there, but it's going to take us several weeks.
1 week into a province-wide lockdown, Chang says it'll be a few more days before we see the impact of those restrictions. Then he says the numbers should start to go down, but only if Nova Scotians follow the rules. Kayla Hounsell, CBC News, Halifax.